Coronary artery disease is the most common type of heart disease. It happens when fatty, waxy deposits called plaque build up on the inside of your coronary arteries, narrowing or blocking them and decreasing the supply of blood to your heart. Your doctor can determine the extent of the plaque inside your arteries by performing a procedure called an angiogram or cardiac catheterization. An angiogram is an imaging technique that uses X-ray technology together with a special fluid called contrast dye to obtain real-time moving pictures of the blood flow in your arteries. These images can help your doctor identify the exact location of any narrowing or blocked arteries and can also show the degree of plaque buildup. Angiograms take place in a cardiac catheterization lab. To prepare for your angiogram, a nurse inserts an IV into your arm to administer mild medications to help you relax. Then small sticky pads called electrodes are placed on your chest to monitor your heart rate and rhythm. Your wrist or groin area is cleaned, shaved and numbed. Then a tiny puncture is made and a short tube called a sheath is inserted gently into your artery. Next, your doctor inserts a small guide wire and a long, thin, flexible hollow tube called a catheter through the sheath to access your coronary artery. During the procedure, your doctor injects contrast dye through the catheter and into your bloodstream, so your arteries can be viewed on the X-ray monitor. At certain times, you may be asked to hold your breath for a few seconds, allowing the X-ray image to be taken. Your doctor will inject dye into your right coronary artery opening, known as an ostium, as well as your left coronary artery ostium. If a significant blockage is found in one of your arteries, a percutaneous coronary intervention or PCI may be performed to help open your narrowed artery and restore blood flow. Before performing the PCI, your doctor may also choose to X-ray your left ventricle to see how the ventricle and valves are working. To begin the PCI, your doctor inserts a catheter with a small balloon on its tip through the sheath and into your artery. Once it reaches the blockage, the balloon is carefully inflated to flatten the plaque against the artery wall. It's normal to feel some mild chest pain when the balloon is inflated. In some cases, balloon angioplasty alone may not effectively open your blocked artery, and your doctor may recommend placing a coronary stent at the site of the blockage. A stent is a tiny, expandable, wire mesh-like tube that acts like scaffolding to support the artery and help keep it open. The unexpanded stent is mounted on a deflated balloon catheter. Your doctor inserts this catheter through the sheath and into the blocked area of your artery. The balloon is inflated, expanding the stent against the artery wall. After the stent is fully expanded, the balloon is deflated and removed. The stent holds the artery wall open to maintain blood flow and stays in your artery permanently. You won't feel the stent in your body, and over time, the inside lining of your artery will grow over and cover up the stent completely. To check that your stent is well placed against the artery wall, your doctor may deliver a stiffer balloon through the sheath and into the blockage site. This balloon is inflated to ensure that the stent is fully expanded and pressed against the artery wall. When your doctor is satisfied with the placement of your stent, final X-ray images are taken to be sure that your blood flow looks favorable. Then your doctor gently removes all of the devices used during the PCI. The puncture site is sealed with a special device applied to your wrist or groin area, which stays in place until all bleeding has stopped. After your procedure, it's important to follow your doctor's advice and take all prescribed medications as instructed. As with any medical procedure or treatment, talk to your doctor about the risks and benefits of coronary artery stenting to see if it's the right option for you.